Hello everyone, welcome back to Mind Matters. Today we're talking about postpartum depression. I'm Shelby.
And I'm Addison. And today we also have a special guest, my mom. So that's going to be awesome.
The definition of postpartum depression, also known as baby blues, is a medical condition that many women have after having a baby.
Also, please ignore the loud air conditioner in the background. We're trying our best to be as loud as we can so you can hear us. But if it's hard to understand, well, then you can just skip this. We're trying our best to do this, so I'm sorry. We have to film in a school, and there's nothing we can really do to control that, so I'm sorry. Anyways, postpartum depression, it's a strong feeling of sadness, anxiety, worry, and tiredness that lasts for a long time after giving birth. These feelings can make it hard for you to take care of yourself and your baby.
Symptoms of postpartum depression might include insomnia, loss of appetite, intense irritability, and difficulty bonding with the baby.
Some treatment for postpartum depression include counseling, antidepressants, or hormone therapy. So if you are experiencing postpartum depression, these are the things that you will have to do in order to feel better. There's different types of postpartum depression. Some is like very intense, and some also is like not intense at all. So if people around you are noticing that you've changed a lot, like for the worst, please, get counseling. Maybe talk to your doctor about getting antidepressants if you're feeling very depressed, or hormone therapy. That for sure helps too, because it does. So I hope that if you are experiencing postpartum depression or just postpartum difficulties in general, that you consider these things.
Some causes of postpartum depression is lack of social support. That's like whenever you kind of center yourself in with just your baby and not like anybody else, like your husband or anything. Domestic violence in the form of a spousal, sexual, physical, and verbal abuse can also be a factor of it. Smoking during pregnancy is a risk for developing postpartum depression.
There's many different types of postpartum depression. So here are some of them. Postpartum blues, aka baby blues, postpartum anxiety, postpartum obsessive compulsive disorder, OCD basically, postpartum panic disorder, postpartum post-traumatic stress disorder, PTSD, and postpartum, what is that word? Psychosis? I don't want to say it wrong. Psychosis, my bad.
Close.
There we go. Sorry, I don't always get these words right, but, that's what all of the different types of bipolar disorders are. So these are things that your doctor or therapist might, say that you have, basically.
You should always see your medical personnel as soon as possible. And another thing that I thought was kind of not necessarily weird, but kind of interesting, is that your OBGYN, they are trained to help with postpartum. I just never knew that, so I thought that was cool.
So if you want to talk to her, or men, or them, you can. They're
are
certified
trained
in that.
Yeah, I didn't know that. I didn't know they were certified in that.
Well, yeah.
I know now that I say it out loud, I'm like, okay, that makes sense. But
if you didn't know, there you go. Here's some things that your doctor might say to you. Your healthcare. Sorry, you guys. Your healthcare provider will usually talk with you about your feelings, thoughts, and mental health to determine if you have a short-term case of postpartum, which is baby blues, or a more severe form of depression, like postpartum depression, because there is different kinds. Just like regular depression, there's different kinds of depression and bipolar disorder. Bipolar 1 disorder is way more effective than bipolar 2 disorder. So even if they're not as effective, they still can change a lot. So even if you're feeling a little bit of postpartum, it'll help to just get a little bit of work, because that's what most doctors and what were those things called that you said? OBGYN, yeah. Those people are certified and things like that. So if you are questioning if you have postpartum and want to get treatment for it, then you for sure should talk to them, and these are the things that they will say to you. Also, don't be embarrassed. Postpartum depression is very common. Share your symptoms with your provider so that you and your provider can create a useful treatment plan. Basically what I just said. Treatment and recovery time vary depending on how severe your depression is and what your individual needs are. I'm sorry, you guys. My grammar is so bad today. If you have an underactive thyroid, is that what that says?
Yes.
Or an underlying illness, your healthcare provider may treat those conditions or refer you to the appropriate specialist. Your healthcare provider may also refer you to a mental health professional. That is that's something that we've talked about a lot. Is if you are considering or thinking about any of these feelings, or noticing that you have a lot in common with what we're talking about, please get a counselor, because those really do help. And for some people they don't, but most people they do, and most people do need somebody to talk to. So if you need somebody, please talk to them.
Some symptoms of baby blues is some things that may help out with baby blues is usually it fades within a few days to 1 to 2 weeks. In the meantime, you should get as much rest as you can, accept help from your family and friends, connect with other new moms. Like, there's a bunch of like different mom groups, I guess that's what you call them, that a lot of them are going through the same thing you're going through. Create time to take care of yourself, like even if that means just running yourself a hot bath and sitting in it. Like, just do something to give yourself a little me time. Avoid alcohol and recreational drugs, which can also make your mood swings worse, so there's just no point in even doing it. Ask your healthcare provider about getting help from a health professional called a lactation consultant if you're having problems with producing milk or breastfeeding.
Hey, so here we are with our special guest, my mom, Ashley Oxford. Do you want to say hi? Okay, so our first question. Have you ever experienced postpartum depression?
With both of my pregnancies, once I delivered Addison and Rowan, I think I experienced what's more commonly referred to as like the postpartum blues more so than depression, because depression, I believe, has to last for a longer period of time. And with both of them, my depression, if you would say that, was more just for a few weeks after I had them. And I didn't need any extra help, like with medication or any talks with the doctors or anything like that. It kind of resolved on its own. But I did have, like I said, what we call the postpartum blues with each of them.
Okay. Have you experienced any other symptoms or like effects from postpartum after you had both kids?
I think what affected me a little worse than the depression, because that was more short term, and like I said, it's kind of common. It's more related to the fluctuation of your hormones, because right after you deliver a baby, your hormones just kind of go crazy. And so the depression was temporary, but I think what lasted longer was anxiety. I definitely had a new sense of anxiety that I didn't have before. Worrying with like the well-being of both of my kids, like things that you don't think about before you become a parent. Like I had more anxiety related to some of those thoughts.
Okay. Do you have any questions for her, Shelby?
I don't know. I can't think of any. Okay. What are some ways that you like coped with your like anxiety and stuff?
I don't know how I cope. I just do my best. I feel like I've had anxiety my whole life, but the type of anxiety that I experienced after having children, it changed. Like I had more health anxiety, both for myself and for the kids. Like I said, it just goes back to things that you don't really think about before you have children, and all of a sudden you're responsible for this tiny human, and it's just kind of scary. I think if I do turn to anything for help, the thing I turn to the most, myself personally, is my Christian. I said that wrong. My Christian beliefs. So like prayer and just reading the Bible and stuff like that. Like that's what I turn to the most. I don't feel like my symptoms or what I experience is severe enough that I should seek help for it, because it's not affecting my life. Like I'm able to live my normal life and get through without any extra help. And it's okay if you do need extra help, and you should definitely talk to a doctor and talk to a therapist or whoever you trust if you do have severe anxiety and if it affects your daily life. But mine was never that severe, so I just kind of deal with it.
I think that's all. Thank you all for listening today. Also, thank you to my mom for coming on. Her birthday is Friday, December 8th, which is this Friday coming up. Right now we're currently filming the Monday. But so if you're listening and you want to comment, please tell my mom happy birthday, and thanks to my mom for coming on. If you do notice that any of these postpartum things are what you feel and affecting you, please seek help, because it can worsen your baby's health and also your health. And as a mother, your main priority should be yourself and your baby's health. So please talk to somebody if you are experiencing anything like this very severe, because it can affect a lot of things. Thank you all for listening. Bye.